Chris Master here, and welcome to the first session in this YouTube channel. So what I'm going to do today is cover calculators in medicine. I'm using hepatology calculations as an example. I'm going to suggest the following app, MELD Calc, as this is an app that has grown over the years, and what I had to do in the past is actually have 2 or 3 calculators because I can't go to one particular app and have everything in there. This has changed with the MELD Calc, and it's brought on some interesting new things which I'll demonstrate later in this session. So that's MELD Calc. Right, so the calculations I'm going to go through with you will be to show you how MELD Calc does that and how you can use that on the wards, but also what question are we asking and hoping that the calculation will help us answer. So Child-Pugh is a calculation I used as a student to determine risk of rebleed after a first varicose bleed in a patient with cirrhosis. So the parameters that it uses will be bilirubin, so indication of liver failure as a surrogate marker for that, albumin and INR for synthetic function, and then ascites and encephalopathy as markers of decompensation. So altogether, what will this give you on the ward? So you already have a patient with cirrhosis, so that must be confirmed. Then how bad is the cirrhosis? So it'll classify it in A to C, A being compensated cirrhosis, so it gives you an objective parameters to say this patient has compensated cirrhosis. However, B and C will be decompensated cirrhosis, and there will be a risk, and it can give you also a perioperative risk score. So the next model, and I must just mention the timelines here. So the first one I mentioned I used as a medical student, so it's been around for quite a while, and this calculation was developed in the 60s and published in the 60s and 70s. This is a relatively new model, and this was developed in the early 2000s and found to be superior to Child-Pugh for determining things like suitability for transplant. So what it looks at is, first of all, renal function, as this could be a marker if you have a patient with impaired renal function. That's a poor prognostic marker. So, and it means that this patient is at increased risk of dying. The dialysis and creatinine measures that then. Bilirubin, once again, a surrogate marker for liver failure. INR synthetic function. Sodium is a reasonably new addition to this calculator, and it gives us an idea of fluid overload. The surrogate marker for ascites. So it gives you the objective parameters here. And now, context, I've done the calculation. What does it mean? If your MELD score is more than 13, the patient should be considered for liver transplant and sent to the transplant team for workup if there is not a contraindication. If the MELD score is getting to 22, 23, this is when the transplant team will then activate the patient in entering for recipient of a donor liver. So that's 13 and 23, roughly rough estimates. And then the other thing is it also is a very useful prognostic tool to determine and explain to the patient what their risk is of mortality in the intermediate future. Then the next question is, now that we've done scores for patients who have cirrhosis, how do you know they have cirrhosis at the bedside if you've not done an ultrasound yet? So this is where APRI comes in, and I must mention that the next 2 calculators, I must acknowledge the nurses in the liver clinic who have introduced me to these 2. So normally an AST is around the 35 mark, platelet count is 150, so you can see AST is usually a lot less than platelet count. But in chronic liver disease, it reverses, and if you remember, hypersplenism due to splenomegaly, which is a complication of portal hypertension, there you will have, for example, a platelet count of 50 and AST of 75. So that those 2 have in actual fact reversed in their ratio. And this is what the calculation uses. And if it's positive, meaning that the ratio is flipped, the specificity of saying that this patient does have cirrhosis is more than 90%. And I'll demonstrate that soon. A last thing, and this is not an MD calc, but it's a useful score to know alongside all these others, is if you have a patient with compensated cirrhosis, or child Pugh, MELD score is 9, but the APRI score is positive cirrhosis. This helps you to determine whether they need endoscopy for variceal surveillance soon or not. So if the platelet count is more than 150 and you get a fibroscan done, which is a tool that measures liver stiffness, and that score is not that high, you have safety in knowing that this patient doesn't need to go to endoscopy quite yet for variceal surveillance. So it spares the amount of patients you refer for endoscopy. Right, so with all those explained, let's go and see what they in actual fact, how do I get there? Right. Right, so this is what the interface of MDCalc looks like. You can see quite a nice looking interface. You can search your calculations from here. You can also create favorites. That's quite useful to use. So let's just jump in and look at the first calculator. So what's nice about the MDCalc is at the end, it'll give you next steps that need to be done, evidence. So where can I find a publication on this, should you need one or interested in one, and the creator and some insights on that. So it's more than just a bland calculation tool. It does give you some idea on that aspect of the score as well. So let's say we give this patient really bad numbers. Let's see what we get up to. Right, let's be kind in terms of the encephalopathy. So you'll see it gives you, this is a child PC, so not unexpected life expectancy, it gives you that, and it gives you a perioperative mortality score. So it's quite useful. The other one I mentioned is the MELD score. So if we punch some numbers in there as well, so the patient doesn't need dialysis, however has a creatinine of 100, bilirubin, we're going to say 50, so we're giving this patient some liver failure again, and 1.5 there, and that. And it'll give you that. So this patient needs to be already worked up on transplant list, and you can see it gives you a nice estimate of mortality there. Right, AST, ALT ratio. So let's just do one here. Let's say 75, right? Abnormal. And that's going to be my upper limit of normal 40. And my platelet count has dropped to 72. So what happens with that? See, it's reverse. So the score is more than 2. And you've got specificity of more than 90% for severe fibrosis and cirrhosis. That's not a very sensitive test, so that's not what you're using it for. You just want to know, does this patient have cirrhosis? Right. So Baveno Criteria, you just search for that and get your first best reference for a abstract, and that'll be in here. And you'll see those two parameters there, and you can avoid doing endoscopy in the near future, and just keep monitoring the patient in the interim. Right, so I hope you found that useful, and see you on the next video in the next week or two.